Hi, everyone, and welcome back to A Better Future Starts Here, a live weekly show brought to you by the American Society for the Positive Care of Children, otherwise known as American SPCC.org. I'm your host, career and public speaking coach, author, and community advocate, Tracy Kawa. First, a little bit about American SPC. So, American SPCC is dedicated to improving the lives of children in the United States. We are America's voice for children, bringing individuals and organizations to ensure that children are raised in a safe environment so that they may thrive and become happy, healthy, functioning members of society and secure leaders of tomorrow. Our goal is to bring you perspective, industry knowledge, support from the experts in the field who are dedicated to empowering both children and families. So today we are happy to bring you Self-Regulation with Jeannette Sandoval. Jeannette is a mental health and wellness professional with a private psychotherapy practice in Los Angeles, California, where she works with families, couples, and individuals. Jeannette curates psychoeducational training for staff development and wellness for organizations. She works with K through 12 schools to support mental health of kids in the education sector. Jeannette is a member of the Mental Health Consortium for Congresswoman Grace Napolitano. Jeannette received her BA in Psychology and Communications from California State University, LA. She has her master's in marriage and family therapy from Pacific Oaks in Pasadena, California. And if that is not a list of accomplishments that is enough, then Jeannette has also been featured on a number of media outlets, including ABC and iHeartRadio, where she highlights the importance of mental health. Before working in mental health, she did work in the television industry, where she produced and hosted for a number of networks and the media outlets, including KTTV, Fox 11, Style Network, Sports Illustrated, and she was a long-term host of a nationally syndicated show on ABC. Jeannette recognized an undeniable draw towards psychology, and she decided to pursue a professional path which would allow her to dive into what moved her the most. Thank you so much, Jeannette, for joining us today. I'm really excited that you're here.
Thank you for having me. I'm very excited to be here.
Yeah. So tell us a little bit about your passion or how you developed this passion for children and families.
Yeah, I mean, it's interesting having like that background in television, and it was great. It was fun. And I decided to pursue graduate school. And I really realized that I fell in love with psychology. I fell in love with human behavior and just the human experience. So, I was just drawn to it. It was undeniable. It was something that I just couldn't help it. It was bigger than me.
Wow. Isn't that great when you identify a passion? You know, I study a lot about human behavior because I work with an assessment tool, and they're always giving us, right, this valuable insight into human nature. And human behavior is such a fascinating, huge field and ever growing, right? Because we're always finding out more and more information about it.
It's never ending. That's what makes it so exciting, I think.
Yeah, I agree with you. Yeah. So one of the questions that I personally had was about clarifying the difference, and I'm sure our listeners would want to hear, what is the difference between psychiatry and psychotherapy? Like psychotherapy sounds so intriguing.
Doesn't it though?
Yeah, it does.
Yeah, so psychotherapy is sort of like an umbrella term for a professional who is trained to treat emotional challenges and things that come up. Where a psychiatrist is very much, they can still be a psychotherapist as well, but they actually have a medical degree, so they're able to prescribe medication. And so that is sort of, I want to say, like the fundamental difference that people are aware of. Yeah, it's a pretty big difference.
How would somebody know? Would somebody know if they needed a psychiatrist versus a psychotherapist? Who would be the one diagnosing that?
Yeah, so typically there are referrals that are made through a doctor And so, for instance, in this context, if your child became very sad and there were suicide concerns, that child might be hospitalized for extra support. Many times we see a child leave an institution like that where they are linked to a psychiatrist at that point, and they may be put on medication, or they just have a higher level of need that sometimes does require medication, where other kiddos may just come out and be told, okay, well, we need to link you to counseling, so more like talk therapy. And in that case, it would be a psychotherapist. Yeah.
What about in the case of somebody who perhaps needs some medication for ADHD, or even to be diagnosed with ADHD?
Yes, I think that would definitely be your doctor, or the doctor would refer out to a psychiatrist. And many times it should be mentioned that a psychiatrist and a psychotherapist can be a part of the treatment plan for the patient. So it's not one or the other all the time. And so that's important to note too.
Right, that is, because I think we generally think of in terms of one or the other.
Right.
So I'm glad you clarified that.
Yes. Yeah.
When,
that's a big notable thing to clarify. So I'm glad you asked that. Yeah.
In the context of psychotherapy, how can families create safe spaces where they can truly listen to their children, right? Because today's conversation is about like self-regulation and listening and communication. So how do you think families can create safe spaces?
Yeah, well, I love that question, because that is like the meat of the work that I do. If you think about it, Tracy, if you and I were to describe what would allow us to open up, to be vulnerable, we might have a list of things that make us feel comfortable, right? For me, maybe it would be not feeling judged by you, or feeling that I can say something and it wouldn't be wrong to you. You wouldn't hold it against me or withdraw being close to me, right? And so for you, it might be something else. And so it's really important, I think, to create safe places between family members, and whatever that looks like. Sometimes it isn't mom and dad, sometimes it's a caregiver. But I think an interesting question to ask oneself is, what doesn't feel safe? When we think about having a toddler in a home, we think of the dangers, right? Like the stove, the outlets. We identify those, and then we sort of build a safety plan, whether we say it or not overtly, but we sort of create a safety plan around what would be harmful. And I would just encourage, I love using metaphors like that, but encourage families to think of what would feel harmful, feeling judged, being laughed at, having something minimized, like, oh, you shouldn't feel that way, you're too sensitive, or just sort of making judgments around what a person is expressing. And I think probably the biggest sort of home run that I've seen with families is when the adults are able to be vulnerable first. When they're able to say, I'll do it first, I'll have the courage in this space, and they bring value to being vulnerable, versus creating a narrative that it's weakness. I hope that makes sense. But
it does. I was actually going to ask you for a little more detail in the way of maybe an example. Can you think of an example where a parent, rather than just saying, you should be this way, where they actually demonstrate that vulnerability?
Yeah, I think what comes to mind is, I've worked so much with families, and there have been those moments where it turns around for them, and it's not overnight, it's baby steps. We celebrate those baby steps. And I think probably a good example of that is if a kid says, I'm really sad that you and dad split up. I'm really, really sad. And a parent might think, well, if I change the subject or make it fun, it'll take the pain away. So let's go get an ice cream, or let's go do something fun and get your mind off of it. And so the child might be thinking, this parent doesn't want to talk about it. This is too painful for her. So I'm going to take care of her and not talk about it. And then mom is like, I'm going to take care of him and not talk about it. And everyone's holding all of this by themselves. And so what I've seen, one of the most magical things I think a parent can do is in that moment say, I'll do it first. I'm not going to wait to hear that you're worried, scared, anxious about this new change in our family. I'll talk to you about it first. I'll give you the license to say that you're scared. I'll give you the license to say that you have anxiety about it, or any questions that you might be holding on to that are keeping you up at night. I'm going to create a space intentionally where you can ask that, where you feel free to do that, and I'm not going to judge you for it. And so I don't know if that's an example.
I love that. Yeah, that's really enlightening. And it takes a parent who, like you said, is not afraid of being vulnerable, a parent who wants to create that safe space, who wants to share, who wants to listen, right?
Definitely.
And create that space for their child to share honestly, because you're right. It is easy to say, oh, don't feel that way. Or, oh, no, it's okay. It doesn't bother me. And then, the parents in their room crying at night, but, putting on this stoic face. And then the child learns that behavior and nobody's ever talking about anything.
No. And there's a pseudo feeling that like, oh, they're better. Look, they had the ice cream. Everything's going to be okay. So it's really tempting as a parent to want to leave it there. Look, there's a smile on my kid's face. We're good.
They just fixed it all, right? An ice cream. But in reality, things get pushed down subliminally.
Yeah.
And one day, a child can just become unhinged.
Yep. That's exactly right. And the messages that we're sending in that dynamic is, we don't talk about things in this home. In this relationship, this is not welcome.
Yeah.
And think about what that child then leaves that home with when they go into other interpersonal relationships. It's like, well, I don't talk about my feelings. Let's go fix it with a martini. Do you know what I mean? Like, that's the reality of what happened. The ice cream gets replaced.
The ice cream gets replaced with something that can be more dangerous.
Yeah, absolutely.
Wow. Well, thank you for walking us through that. That was pretty eye-opening, actually.
Yeah.
Do you have any anecdotes or success stories that maybe stand out to you regarding your work with families?
Yeah, I was thinking about this, and something that comes to mind. There are moments that definitely stick out in the years that I've done this, now 6 years, and it always was a moment of courage for a parent. One that comes to mind is when I had to make a DCFS report, which is like a child report, and I spoke with the mom and I let her know that I was going to have to do this, and I wanted her to know why, and I also wanted her to know that that I'm doing this in the spirit of helping her, and I feel that things have gotten out of control, and I really want to link her with some support.
Wow.
And I had a lot of anxiety having to do that. But I think about the courage that it took her to face that. This was a woman who was well-meaning, who was brought up thinking that this is how you make a kid tough. This is how you build resilience.
Yeah.
After you leave this house, no one out there is going to know how to hurt you, because I'm going to give you that tough love. And again, it came from a really great place. But I think what I think about in that story is how difficult it was. It was kind of in the earlier years when I started psychotherapy, that I really had to work. Oh my gosh, Tracy, this was a big thing for me. I really had to work on the empathy in that scenario, right?
Yeah.
The empathy for the parent, because just as I mentioned before, how a child needs to feel safe,
Right.
a parent needs to feel safe too. A parent needs to feel like, look, I am an ally. I'm not against you.
Okay.
I don't want to walk away from this interaction with more judgment. I want to help you. And so it's really being intentional in those spaces of like, how can we get the buy-in from the parent? How can we give the message that we're here all in the name of getting your entire family in a better place, including you? It isn't like an anti-parent thing. And so I feel like just as important as it is to create that space and that environment with kids, I find it to be equally as important to create that with families, to let them know that these resources and these supports and the systems that we have in place are there to help support them and foster, a healthier family dynamic.
That's incredible. I mean, if you really think about it, it's not just the child that needs the support, it's the entire family.
Yes.
Especially in the case, I mean, are we talking about in a case of abuse, in a case of, a parent causing the problems that's stemming from some kind of emotional pain on the parent's part, and then getting them the resources that they need to make the changes and to break the cycle of abuse?
Yes, it's so important. It's so important. And I think sometimes, unfortunately, the systems are there in place, and it's so much about the person who's facing that mom or dad or caregiver in that moment. It's like the delivery of that, because we could say two of the same things verbatim, like, I want to help you, or it could be like, I want to help you because you're like a mess, right? It's like how delivery being executed, right? And I think that's so important to do that in a way that's intentional and that feels safe for the parents.
Yeah, that's tremendous. And I'd like to point out something, which is that earlier you spoke about a parent having this essence of vulnerability, right? Being able to step into that space of vulnerability. And then you're talking about the parent having courage. So I think there's also a lot of emotional intelligence that goes into parenting, that if we really take a look at ourselves and we say, where is it that I need to grow? Where is it that I need to learn? Where is it that I need to reach out for resources? Because even the best parents make mistakes sometimes. And Lord knows, some of the parents that aren't the best parents can use the support. And like you said, in a very non-judging type of way. What are some of these resources that can help the parent build emotional intelligence, or at least where they can learn and grow, maybe learn parenting skills, or how to communicate, or how to be vulnerable, or how to have that courage, or how to increase that emotional intelligence?
Yeah, well, first of all, I fell in love with the Happy Child app, so I just want to plug it. I'm just like, this.
We love the Happy Child app.
It is incredible. I don't know. I mean, this is long overdue. I'm so excited. I was doing cartwheels inside. I'm so excited about this app. I think it's a good place to plug that.
Right. Yeah, no, for sure.
And it's free. It's absolutely free, which is
100% free. And they can go right to our American SPCC website and download it. Where I can have a banner. Check that out. What I can do. I taught my son how to do that. Yep.
It's
go
so
to SPCC.org and download the Happy Child app. We'll leave that up for a minute.
Yes.
And what else?
And I would say too, when I think about how can we make a difference, like what can we do in this moment? And it's interesting. It's in the power of the moment, right? I think it was the Austrian neurologist. He was a neurologist that said, between the stimuli and the reaction, and I'm paraphrasing, but it was like between both, there's an opportunity for growth, right? It's like, how do we respond? Right. And it's in that response that we have our freedom and that we have our growth.
Wow.
Wow. If we can stop and pause, like if it's one thing, if there's a parent tuning in right now, and it's like, what can I start right away? Maybe you don't have a reception, or maybe you don't have your phone near you and you're not ready to download the app yet. In this moment, just being really present to how your response is. How reactive are you? And can you just stop and pause? Because it is in that response that lies our growth and our freedom. Freedom from everything that is behind us historically in our family tree, everything that we went through as kids.
Yes.
If we can pause and break that, how powerful that would be. And I think, having sort of realistic expectations around that, knowing that it's not going to be overnight, even if you move the needle a little bit. Even if I changed my reaction from how I reacted yesterday, just a little bit today, a little calmer. Maybe I just pause this time. Maybe I just learn how to pause before I react. And it's like, okay, I didn't really love my reaction still, but at least I learned how to pause today. Tomorrow, it's like pause and then think it through a little bit. Think about how you can respond differently. What can you change in this moment? Right. Another thing that comes to mind is people often think, well, it's too late. The kids are already expecting me to be X, Y, and Z. it's too late. I do this without even thinking about it. It's something that just happens. It's the way that I am, or it runs in my family. I hear a lot of this kind of stuff. And I would just say that, I've been doing this work, and I'm sure, Tracy, you've seen too, that this can be changed. You can make changes in the way that we parent.
Oh,
I
yeah.
see it every day. And
Yeah.
so, please allow me to be a reminder that it's in the baby steps. Sometimes we're meaning makers. And so if we kind of, we have challenges and we're not able to do it right away in the moment. And let's say we go backwards and we say, oh, I did that thing again that I used to do. We make it mean that we're terrible people, or we're just, not good enough, or we should just give up. But really, it's just being aware and pushing ourselves a little more the next time, and getting comfortable with that and being patient with the process, because it will not be overnight. It will not be. And so I think that's probably, and of course, So the app I love because I personally, and it may not work for everyone, but I personally love to interact with technology as a way to sort of keep me accountable, but it's in a private, low-key way, which is so brilliant.
Yeah.
This space, it's low-key. It's there when you need it. And I think it's nice to have. And so for me, I would gravitate towards support that way. Also, just getting really plugged into the community. Trust me, when you connect with other parents, you'll see that people have very similar challenges.
Yeah.
They might have different details to the challenges, but we're all trying to do our best. And really, part of this message, or this sort of campaign for children, is not just with parents. It's for like any child-facing adult out there. Those are teachers. Those are people, babysitters. Those are older siblings. Those are, aunts and uncles. I mean, we have such a responsibility because kids are forming their self-concept based on everything around them. And that includes us. And so even if you're not a parent and you're listening to this, if there's a child in your life that you love, it's really worth learning about ways that you can foster and foster strength in their self-concept and help them thrive. And so it's so exciting and it's so magical to be a part of a child's life in that way. So if nothing else, I hope it's infectious and people are feeling excited about what we can do in the lives of the children that we love. Yeah.
I love your positive energy and your enthusiasm. I think you touched on so many great topics. And as far as the Happy Child app, you're right. It is like your own personal pocket support.
Yes.
Right. And I love the idea of the concept of hitting the pause button, because that's something simple that we can do today. We don't have to become the perfect parent overnight. Just like you said, those simple steps that will support us along the way. And again, it's like I always say, when you make decisions, right? I once heard like a great coach, Tony Robbins, say that when you make decisions, you're exercising your decision-making muscle. Well, a lot of things are like that. Hitting the pause button, that's exercising your self-control muscle. Like, just hit the pause button. You don't have to respond immediately. Gather your thoughts, calm that temper down, grab a glass of water.
Yes.
Cool your brain down, count 1 to 10, and then respond, or maybe let it process. Right? Maybe just ponder the whole concept and then rediscuss it later when you collected your thoughts. So I love that.
It's not going anywhere. Go ahead.
It's not going anywhere. It's not right. It'll be there. Exactly. Tell us a little bit. I know that you've been working on something special that you're launching next week, is it?
Yes. Well, so it's going to be available to schools across the nation in fall, but I am the website will be live by this Friday. So
this week. Okay, the website. Tell us about it. What's the website?
Yeah. Well, so it's welleducation.org. It's a nonprofit. And I apologize. I don't know if that's me or I don't know what I'm doing, but if there's a sound feedback. But so basically, my background was, that I did work quite a bit with K through 12, and I still do. Just kids are going through so much, and, they're trying to navigate all the emotions that they're feeling, everything going on. I've heard, especially now, since the pandemic, just people referring to this time as the mental health tsunami of need. To tell you, Tracy, it is so true. I mean, the need is so great. There's no arguing there, right? So it is coming at a timely season, but this has been in the works for quite some time. So what I saw working in K through 12 was that a lot of kiddos would have to be referred to a therapist. They would have to, and there was such a small fraction of them that actually got access to those services.
Okay.
And there was such a need. And so really what I did was I was wrestling with how can I create something that shows up for this great need that's out there. And it's something, again, I don't know why at night is when I have all these thoughts and it keeps me up, but I thought I have to create curriculum that can be integrated into like mainstream our educational infrastructure that has, that brings wellness, that brings mental health tools for kids. It shouldn't be that we give them access to it after there's been a crisis only, or it shouldn't be, that we give them access only when we find out there's self-harm or child abuse. This is something that I feel, that mental health has got to have a seat at the table of education. It's long overdue. I'm super excited about this. So it's welleducation.org. It will go live on Friday.
How do you spell the word education?
So it's well in education. So it's WELLDUCATION.org.
Welleducation.org. Good. So what we're going to do is we're going to just bring it up on the screen for a minute so that we can across the bottom. Okay, that came up a little different. Welleducation.org.
Welleducation. And again, it's not live until Friday, but super excited about it. Keep an eye on us and check out our updates as we get closer and closer to launching this. Yeah.
Kudos to you for identifying a need, because it's all about identifying a need and then educating people. And the fact that you're not waiting till after the fact. And your mission is totally in line what we do at SPCC.org, right? Mm-hmm. We're bringing information that we're hoping parents use as an ongoing resource. Parents, children, caretakers, not waiting till after the fact. Yes, we're here after the fact also, but it's about the more you can do preventative education, the better off everybody is.
Absolutely. I agree. I couldn't agree more. That's why I'm so excited to be here today, because this organization is so aligned with my vision and passion. And so thank you for having me.
Yeah, thank you as well. So a couple more questions, if you have a little more time. So you were saying about, one of the questions that we always ask is what children and caretakers, parents and caretakers can do today. And one of the things that you said was hit the pause button. Mm-hmm. And I think that is absolutely ideal. Is there anything else that you would recommend if a parent wanted to, take action, something that they could walk away implementing?
Yes. I'm so glad we have a little more time. So this is something I love to tell families. And it's not just for kids. You can apply it to adults, challenges that happen in life too. But it's super simple. And I have them draw a big circle, right? Whether it's a kid or an adult. Yeah. So for the kids, I'll say, let's write all the things that we feel we're worried about, concerned, scared, anxious, all of those things. And now I want you to draw a smaller circle, and I want you to name all the things that you can do about it. So let's take COVID, for instance. The kids will write, I hope my parents don't get it. I hope this, I hope that. I'm scared of this. What if we don't have toilet paper? I mean, we've seen it all, right? And so the smaller circle is what I can do. I can wash my hands. Yeah. I can, some kids put, I can pray, or I can make sure that I wear a good mask and put it over my nose. I mean, so they really kind of identify the things that they can do. And what I do is I'll just ask them that every time you notice your thoughts going into the bigger circle of that area that feels out of control and stresses you out and makes you anxious, just gently bring your thoughts back to the smaller circle. And what I encourage parents to do is to sit down with their kids and do this exercise when something comes up in their home. And it's such a way that people can connect, talk about how they're feeling. The parents have even done their own circles and been vulnerable enough to share with their kids as well. And it's such a great exercise, I think, that brings people together.
That's so empowering. And it's so in line with all of the public service announcements about wearing your mask, washing your hands. It's really teaching children that to the extent that things affect them, they can control what they can control. There are some things out of our control, but what you can control, why not harness that?
Yes.
Love that.
Sometimes it has to do with relationships. You know, daddy left, we can't control that, or mommy left, but what can we focus on? I can come up with the time I'm going to call them every day. I can do, I can write them a letter. So it's really about a number of different issues that may come up, but it's such a great tool to have. And all you need is like a pen and a paper. So it's
really about teaching them a strategy.
Yes.
Right. How to strategize when you're faced with something that's difficult.
Yeah.
This is a strategy that they can apply, the children can apply to any situation that feels beyond their control.
And into adulthood, hopefully.
Wow.
So, yeah.
Exactly. And then I guess, how could we best support you on A Better Future Starts Here? How can we help you get your word out about your program? And last but not least, also tell us about JeannetteSandoval.org.
Yeah, so it's actually .com for Jeannette Sandoval.
.com, thank you.
Yeah, no problem. And the .org is Wellducation. So yeah, so if anybody wants to get in contact with me, perhaps you want to collaborate with something or just connect, you can definitely visit JeannetteSandoval.com. And that's just sort of a spot to go and connect, and we can chat about whatever that is. But I would say definitely look out for Wellducation.org. Super excited about the future and what this will, the implications on our education infrastructure. So excited about that, having a wellness and mental health seat in the education system in a way that is not just 2% of the population. It's like everyone to have access to that is such an exciting thing that we're rolling out. So if you want to get involved, look out for it. If you want to make sure that your kid is attending a school that is well-educated, make sure you let the school know about us. And yeah, we'll do our best to get linked up to the schools. So I think that would be something you could do to help is just spread the word.
How fantastic. We're very excited to support you. We thank you for supporting us. Trying to think if I have any last. Oh, yes, there was one last question. When you launch Wellducation, will you come back and be our guest and let us know how it's going and fill us in and help us support you?
Yes, absolutely. I look forward to it. You can count me in.
I would love it. Okay. Thank you so much, Jeannette. You have been amazing. We appreciate you joining us today. And again, I do encourage everyone to go visit Wellducation.org and currently JeannetteSandoval.com. To our listeners, thank you so much for joining us today. If you're a struggling caregiver or parent, know that you're not alone. To access more positive parenting resources, just like the interview with Jeannette, you may visit our Learning Center at AmericanSPCC.org. And thanks to our viewers and donors and all of our supporters, we've provided over 5 million parents, teachers, and caregivers with the tools that they need to help children build brighter futures. So again, as if we didn't talk about it enough, I love, love, love the Happy Child app. Please, if you haven't already, visit our website, download it. Like Jeannette said, it's a free app. It's been researched by a team of PhDs, including psychiatrists and neurologists. And it's a wonderful gamification tool that actually teaches us in short snippets how the chemicals in our child's brain work so that we can respond to triggers within the relationships and respond proactively. Once we learn how our brains work, we can harness these lessons, alerts, and the insights to build deeper and more meaningful relationships with our children. If you'd like to contribute to the conversation, or if you know someone uplifting children in a way that would be wonderful on our show, then we'd love to hear from you. So if you know somebody uplifting families and your community, contact us at info@AmericanSPCC.org, and we'll see how we can get them on the show and highlight what they're doing, all the good that they're doing in the community. Let's make a difference together. Visit us at AmericanSPCC.org to learn how you can help. And remember, a better future starts right here.